Hello. Good morning, good afternoon, good evening, good night too. Yeah. I don't know what time you are watching and where you are watching us from, but I am super, super excited that I have you come my way today again on the Riverside Ghanaian Seventh-day Adventist Church Health Watch. I am glad. Yes. I am glad I have seen you. Yes. Same here. You are glad seeing me here. And I am not alone today. I am right here with Dr. Gillian Kendon. Doc, welcome.
Thank you so much. Hi, everyone.
Hi, everyone. Yeah, she's that nice. So she is a godly woman and she is a dentist. Yes, you are happy hearing this because this is the first time on this show featuring a dentist. So I am so glad you made that mark.
Thank you
Right.
so much.
She is a godly woman with one husband.
Just one.
Just one. And then two beautiful kids. Thank you so much for making the time out of your schedule to be here with us. And my dear audience, I'm so glad you made it. We have an interesting topic today. It's so interesting. Yes. Let me set up. It's so interesting. So, I'm going to go for my ladies today. Yeah. It's all about pregnancy. I know our gents are right beside us through this whole journey of pregnancy. So you would also want to be there as a guy to listen in. Pregnancy has so much concerns, right?
Yeah.
Because this is life coming out of life. And we want to make sure that we preserve those two lives in whichever way appropriate. And a dentist coming up on our show today, talking about pregnancy, she will go chasing the mouth, right? Yes, she's right in our mouth again. And we are talking about pregnancy and oral health. Pregnancy and oral health. Do you think there are so much concerns about this that we should talk about this topic? Why should we be bothered when we are pregnant with our oral health?
Yeah. So first of all, I would like to say thank you again for having me today.
Right. Same here.
Yeah. So I believe there is so many misconception or mixed information about pregnancy and oral health. And as pregnant woman, I'm talking as a mom and also a dentist. We used to run away from the dentist when we are pregnant because it's like our enemy.
Right.
When you, especially if at the beginning of your pregnancy, you have so many situations like pregnancy or sickness.
In the first trimester, you mean here.
So most of the time they're running from the dentist, which is not good because that's the time we need the pregnant woman to come see the dentist. Let your dentist know that you are pregnant. Let him or her know that your due date is you let him know your due date, and this is going to help your provider to give you the
best care.
Yeah.
Right. So if you are trying to change that appointment, right, Dr. Kendon says, no, you really have to do that dental appointment. You have to be in her seat, right? Right. We would come. But do you think it's much of an issue if we don't make it? Does it actually have a problem with the mom or the baby?
I believe, not I believe, but studies show that is with both the mom and the baby. Because I say mom, you need to take care of yourself, and if it's not the case, you're gonna hurt maybe the baby. Studies show that pregnant woman who has gum disease, they call it gingivitis, pregnancy lead for a premature.
Oh.
Yeah, the premature baby, and also sometimes you have a low weight baby. So it's both for the mom and also for the baby.
Right. So let me try and clarify this. I know you have this on mind too. Is it the pregnancy causing a problem? Because before pregnancy, we have our oral health, right?
Yeah.
So do you think the pregnancy actually gives us some risk to some problems with our oral health, or just our regular oral health and plus pregnancy causing the problem?
So yes and no. Yes, because when you are pregnant, you have a lot of hormone in your body, and progesterone, estrogen, those hormones are very high when you are pregnant, and those how to say, so those hormones is pushing or like creating, improving your gum to get very sensitive, inflamed, and just leading sometime when you're brushing your teeth, you're gonna have like bleeding gums. And this is if like me, if I'm pregnant and I have this type of thing, I will stop doing it because I don't want to have that. And this is not good. That's what most of the women doing. And when they're stopping, it's going up, and they have like I said in the beginning, the pregnancy gingivitis. That's one of the most common cause we have. And also there are some specific gum disease that we observe in the pregnant women, which are just for pregnancy. That's also something. And about cavity also, yeah. As a pregnant woman, we all know how you love to snack in the blind food during the lead days and all that. And this is not good for your teeth because bacteria are using it to make a lot of acid, and yeah,
You have issues.
growing up of cavity.
Right. So those of us brushing our teeth as pregnant women, that's where the concern is today. And we having bleeding gums. It's not just like, let me just rinse my mouth and that's it.
Yeah.
We really have to see the dentist, because I never thought that was an issue, because probably I'm just brushing my teeth and then when I rinse my mouth, I'm good to go. Okay.
Also, I'm sorry.
You go ahead.
And also, one thing when a pregnant woman maybe like got vomited, most likely she's going to think, okay, let me brush my teeth to clean up everything. That's actually is not good, because they recommend to wait at least an hour before doing that, because when you're having vomitus, it's like acid, and they make your teeth very fragile, and tooth structures can be removed while you're brushing as soon as, like the same time, like let's say at the same moment. So it's best to wait at least an hour. If you want to clean up your mouth, you can just use like a normal water or baking soda with water to clean up your mouth.
Oh, this is so informative. Right. So you having a sensitive teeth, it's not just for you to have it.
Yeah.
There is a cause to that, and you really want
And you really want to see the dentist.
Yeah.
And he's gonna show you what to do.
I think what I really like so far now is everything you have said, but for the vomiting. You know, in the first trimester, people tend to vomit a lot. And the next thing is, let me just go brush my teeth. Let me just go brush my teeth.
Yeah, so
now we
don't do that as soon you got the vomitus. Wait at least an hour. Some say even 2 hours before brushing your teeth.
Right. So let's talk about the baby. I don't know how it will be so fun lying in the dentist couch with my belly shooting up and all that. I don't know how comfortable that will be, but then we will take the advice in good faith and come see you. But is there a problem aside that with all the postures? Is there a problem? Like, I don't know, there are a whole lot of myths coming up with all these things, cultural differences and all that. Is there a problem seeing a dentist like during pregnancy?
No. That's why I wanted us to talk about it today, because most of the women are thinking, okay, maybe during the beginning or maybe at the end, I don't want to see my dentist because I'm on haste or something. No. At any time, if needed, we can do any procedure for a pregnant woman. The thing is just to focus on what to take care of. Like we know during the first trimester, pregnant woman is very like nausea, dark reflex and all that. We know how to take care of that at that moment. Now, if it's not an urgent care, we can make the woman come back at the second trimester. That's the best part, because at this time you're always like normal, you know how your body is and all that. Yeah. And at the third trimester, most of the time they complain about back pain and the positions on the dental chair and all that. So depending of how long or where you are in your pregnancy, we accommodate to that and we're trying to help you. But at any time, at any time
Anytime
you can
you get
come and
ordered.
have your,
This is good
so
news.
everything is safe.
This is good news. I don't know how much. So you, the guy here, please push her to go for her dental appointment because she's been making all the excuses that I know now we have the air cleared and we can all go to see our dentist as pregnant women, no matter the trimester we find ourselves.
Yeah.
But before we come see you as a dentist, what can we do at home for ourselves
Yeah. So,
as pregnant women with our oral health?
okay. So, at home and for even not a pregnant woman, prevention is a key. So always take care of your mouth, brush your teeth, take care of your teeth, your tongue, your gum, everything. So that's how you brush your teeth twice a day, floss, and that's going to be at least one. If you can do twice, normally it's twice, but if you can at least do it once a day, the flossing. But brushing twice a day. Yeah, with a toothbrush, a fluoride toothbrush, because also there's some miscommunication.
Exactly. I was going to go on that. Yeah.
So that
Is there toothpaste that we could use that's safer or the regular ones on the market? Or do we have a customized one? Pregnant toothpaste?
I miss. No. No, because we don't need it. Okay. So you don't want your regular toothpaste, toothpaste and brush your teeth twice a day and floss. You can use whatever, like some use like mouthwash. Yeah. Also you can use it. Right. You can choose between the except I'm always aseptic mouthwash and the alcohol base. Yeah, alcohol base. Now, depending on your case, like normally the free alcohol is the best because it's not very strong. For a woman, I believe the non-alcoholic is better. But depending on your taste, each of them has the indication. So that's why you need to see your dentist, talk about it, and he's going to recommend the best for your case. Right. But yeah, the hygiene at home is simple. Brush your teeth twice a day, floss, and yeah.
Thank you. Yeah. Hey, pregnant mom. Or a to-be pregnant mom. I don't know, share this video as well. Like we always say, just pause, like, share, and then subscribe. And so this is for us to go see our dentist whenever. But before we go, what will be your last words to say to the general public about pregnancy and oral health?
So, thank you. So for that, I would like to say, like I said in the beginning, pregnancy is not a stop to go see your dentist. Yes. Any procedure in the dentist, I'm talking like local anesthesia, X-ray, because that's also something. X-rays that we have and all that, those are safe if they are doing in the right way. So we just need to know. So just go see your dentist, let him or her know that you are pregnant. And depending on how far you are, they're going to make sure everything is done appropriately. So go see your dentist. Even if you're thinking to be pregnant, it's better to start now, because as a pregnant woman, studies show also that cavities or gum disease for a pregnant woman are moving faster than for a normal, like someone who's not pregnant. So even if you're thinking to be pregnant, it's better to go see your dentist and start now. Do your regular cleaning, go see your dentist at least every 6 months. And keep doing what you should do as a normal patient for your work. And also about the vomiting, that's something is very important. Don't brush your teeth as soon you vomit. Because that's something we all do. Even me, as I was pregnant, my first pregnancy, I just thought I got the vomiting. I was my teeth, and that was not good. So it's something you need to also take care of it. And yeah.
Right. Thank you so much. I know you have been so much informed today. Thank you so much for coming in. Now we know that we have to see our dentist. I know there's so much appointment during pregnancy, but hey, this is also one of them.
Yeah.
One of the important appointments, because we always want a healthy you and a healthy family. for the mission of God. Thank you so much, Dr. Gillian Kendon, for coming.
Of course, thank you so much.
We'll be having more of you on our show.
Yeah, next time I will be more prepared.
Thank you so much for joining me. See you. For now, it's bye.
Hey.